Welcome to Inside the Anatomy Lab, your quick guide to exploring the human body.
Let's dive in and discover the wonders together.
So today, some of you have said, let's do a dissection video with model. Because of some clearance, we can't do cadaver videos for now. But today, we'll show you how to do dissection of the upper limb using a model. We're trying to identify the pectoralis major, pectoralis minor, the thoracic cage, thoracic cavity. Allow me to introduce to you this Folake. We assume that this is a female model, but normally it's anatomy. Yes. So, how do we dissect a cadaver for anatomical identification? First of all, we need two instruments for the dissection. We need our scalpel and we need our surgical blade. Mind you, before you dissect, you must make sure you have your PPE with you. Don't forget that hand gloves, hair cap or hairnet are very important. Safety boots are also very, very important with your lab coat. Thank you. We must first of all have treated the body by the technicians, and let's start the dissection. First of all, important landmarks of the upper limb involve the breast region, the navel, and that's it. These are all important landmarks. And anatomy, we don't cut out the important landmark, meaning that while dissecting, we must leave or make a circle around the breast and around the navel. We don't cut it off. Now, at this point, we can say that the superficial layer or the skin layer have been reflected. Remember that important anatomical landmarks are not to be touched. So you make a circle around the nipple of the breast, taking cognizance of the areolar tissues. Good. Now, the surgical blade runs the point 1 from here down to this point. It goes this way, down to that circle, down to the anatomical landmark of the breast, moving to the wards, glenohumeral joint region at this point. From here also, you take it medially or laterally to this point. Remember I told you, at this point now, there is no longer the skin layer. The superficial layer is off. Once we have taken off the superficial layer, what we are seeing here, this region, is what we call the pectoralis major. Once you have reflected the skin layer, the next layer you have to see is the what? Pectoralis major, which is here. Once you reflect this area, the P major area, the next you will see in line is the pectoralis minor. See it here. So if you look closely, you can see the major difference between the P major, P minor. After you have flapped the P minor, the next stage you will now see is this, the thoracic cage. At this point, you have the thoracic cage. How do you access in to the thoracic cavity? You have to take your scalpel at the joint between the costal cartilage, or yes, at the joint between the costal cartilage and the true ribs, here and here, is where you will use your dissecting kit to cut through at that joint. When you must have done that, that is when you will get this. When you pull this out, when you detach this, you will now see the word thoracic cavity. Before we go, don't forget, the contents of the thoracic cavity involves the heart, the lungs, the trachea, the diaphragm. Please tell us the remaining contents of the thoracic cavity. In our subsequent class, we shall discuss the contents of the abdominal cavity. Thank you. Today, we have come to the conclusion of today's class. Tell us the topic you want us to discuss in the next class. Thank you. God bless you. We love you and we want you to do better.
Thank you for watching Inside the Anatomy Lab.
We hope you found today's exploration insightful. Please subscribe and enable notifications to be in our communities of dedicated learners and professionals.
See you all on the next video.